I'm Dr. Justin Bellamy, a board-certified plastic surgeon. I was born and raised in California. I left California after high school, where I did my college training at Yale University in New Haven, followed by medical school at Hopkins University in Baltimore, then plastic surgery residency for 6 years in New York City, followed by a 1-year aesthetic surgery fellowship with Dr. Rourke in Dallas, Texas, and I've been a board-certified plastic surgeon since then. So why did I become a plastic surgeon? When I was in college, I figured out pretty early on that I enjoyed working with my hands and that whatever I did in medicine, I wanted to make sure I could have an immediate impact on someone's life. So from there, surgery became an obvious choice. I explored all sort of fields of surgery, and plastic surgery struck me as a field that allows the ability to take people and elevate them to the best version of themselves. I would say the ideal patient would be someone with realistic expectations, who's committed to a healthy lifestyle, even after surgery. That's what's going to get you the best sort of impression of your own results. What sets Sculpt apart from all the other clinics doing liposuction and fat transfer? We're taking a procedure that historically has always been done with the patient asleep, and we figured out a way to do it comfortably and naturally to give you a safe and natural result without the need to go under general anesthesia. And so that is the #1 reason to pick Sculpt. If you're looking for an awake procedure without need for anesthesia, you want natural outcome, and you want surgeons who just do this in this environment, then I think that's why you would choose Sculpt. I think the #1 thing I would like patients to know when meeting me is that I work for you. I'm here to make sure that you are satisfied with the result that you get and that we're on the same page in terms of what that is. So I'm not here to sell the procedure to you, I'm here to talk realistic expectations as to what you should expect after undergoing the procedure. My primary approach to making sure that you are comfortable throughout this process, both before, during, and after, is making sure that you have all the information that you need to know what to expect as we go through that process. During the procedure, again, I will give you as much information as you want as we do it. Some people don't want to know anything at all. Other people want to know exactly what's going on at all times. Similarly, after surgery, I'm available for anything that might come up. You're going to have access to the entire team here as well as myself. You should feel like you know what to expect at each stage of that recovery. The #1 thing that brings me joy as a plastic surgeon is seeing that transformation. So the true before and after, seeing where you started and then follow your results. One misconception about awake liposuction with fat transfer is that it's not surgery. At the end of the day, you are awake throughout this procedure, but it is surgery and we treat it as surgery. It's extremely safe. We've sort of figured out how to do it very comfortably. Even though you are awake and we can talk, that doesn't mean it's not a surgical procedure. So it's important that you also treat that recovery process as a surgical procedure as well.
I look forward to treating you here at Sculpt.